The following segment is sponsored by Providence Health and Services. This segment of AM Northwest is brought to you by Family Matters.
Health and education, safety, and the quality of life. KATU and our partners are proud to bring you Family Matters, offering solutions to the hard questions.
Because KATU and Providence Health and Services know that family matters.
Burnout and stress in the wake of the pandemic have prompted many in the medical community to reconsider their profession. Here to share how one local hospital is working to change that, we welcome from Providence Portland Medical Director of Wellness, Dr. Tricia James. Good to have you with us, Doctor.
Thank you.
So the burnout after the pandemic among medical professionals is a real thing, right? I mean, it was really happening.
Yes. Yeah, it was a big problem even before the pandemic, and then COVID just dramatically increased the stress, the complexity, and really the instability in our healthcare system.
How bad was it, and what did you see?
Yeah, at the beginning of COVID. Yeah, I mean, you know, for me personally, I pretty quickly realized it was impacting every facet of my life, and really started having nightmares about bringing COVID home to my family and
for sure.
them dying. You know, it was such an overwhelming time.
And you were overworked.
Overworked.
Yeah, everyone was overworked,
Everyone was overworked, just trying to meet the needs of, you know, a pandemic.
Yeah, and then understand that you came up with a program to help burnout. Now tell me what the program was. It's a kind of a new one.
Yeah, so, you know,
Not kind of new, very new.
Yes, it's new. Early on in the pandemic, I realized that, okay, if I'm experiencing this level of stress, my community is too. And I had had some experience doing well-being work, and so I really wanted to be able to bring additional support to my community. And thankfully, the Providence Portland Foundation and the leadership were really supportive of that and allowed me to create a program with the doctors and nurse practitioners that make up a hospitalist group in the hospital.
Okay.
And really one of the biggest things that we did was identify what they called themselves wellness warriors, which was 3 doctors that became partners in identifying stressors impacting the group in real time, and then saying, what can we do about it in real time?
So give me a stressor, an example of what you're talking about.
Yeah, so, you know, early on in the pandemic, a huge stressor was just information.
Yeah.
Treatments were changing every day, workflows were changing every day, PPE was changing every day. So we created a venue every week where we brought in a specialist to answer questions about updated treatments. We reviewed updated workflows, we improved communication bi-directionally, and then created some space for people to debrief difficult cases and personal challenges.
How would you say how successful it was? I know you published an article about it, right?
We did.
Yeah.
We published an article this year, and, you know, I think, so the burnout rate actually decreased over the year of the program, and this was at a time when the national burnout rate skyrocketed.
Yeah.
So that is one part of it. Actually, the part that I'm the most proud of is that during a time when we all were so much more isolated, by necessity, we were able to bring people together so that we weren't going through it alone anymore.
Oh, that's fantastic. So when you mentioned community, it really was then a community, right? Is it now a permanent program at Providence?
Yeah, so since then, Providence Portland really has been groundbreaking in creating my position, which is Medical Director of Wellness for the hospital. And just last month, we had our kickoff event for kind of the next phase of this project, where we have 22 doctors enrolled to become wellness warriors and bring this work to 20 different groups. So
what would you say to someone at home who has a spouse who's experiencing burnout, or they're experiencing burnout? Do you have one tip?
The one thing that I have found the most helpful for myself and in doing this work is just to get really clear about where we have control. And there's so much complexity and chaos in the world right now that it's very easy for us to spend a lot of mental time and energy where we have no control.
Where we have no control, You control the controllables.
That's right. And that has a cost, right? Because it minimizes our impact, not only on our well-being, but also on the world.
Right.
And so really giving ourselves permission to focus where we can have the biggest impact.
Wow, congratulations on your work. That's fantastic. I want to tell folks, if you'd like to find out more, you can contact Providence Health and Services Mental Health Support, 503-215-9369, or we'll put it on our website, KATU.com/Family Matters. Doctor, thank you so much.
Yeah, thank you for having me.